Obstructive sleep apnea, that is when there is a physical obstruction of your airway. Your airway collapses, you're not able to breathe. Your body's not getting the oxygen it needs. In order to be diagnosed with obstructive sleep apnea, you actually have to have a series of these apneic events. The dangers of untreated or undiagnosed obstructive sleep apnea, it leads to cardiovascular disease, greater risk for stroke or heart attack in your sleep. It's also linked to adult onset diabetes. The list goes on. And basically, if you're not sleeping, your body doesn't have a chance to repair itself. The reason why sleep apnea is so dangerous is because most people don't know they have it. Treatment options for sleep apnea are traditional with what's called a CPAP. That's wearing the mask or the nasal appliance, using a machine that forces oxygen into the body. It's still the best, most effective treatment. But the sad thing is 75% of patients that begin treatment with obstructive sleep apnea with CPAP stop treatment within 6 months. They just don't like it. The other option, that's where dentists who are trained and understand how to treat and work with specialists using an airway appliance, a special appliance that holds your jaw in a position to help stabilize your airway so it doesn't collapse.